Hi, I go book on suicide within college males in the US. I wanted to start off by discussing some important stats and its relation to class context. Suicide is the 10th leading cause of death. There are over 1 million attempts per year. While women have higher rates of depression, men have higher rates of suicide. 90% of those deaths had diagnosable mental conditions. Depression, for example, is a treatable condition, but so many young women are afraid to ask for help or are less willing to show vulnerability. So they suffer in silence instead. This can make suicide feel like the only option for men. The rates are increasing steadily, doubling since 2000 to now. It has been shown that teens and young adults have suffered higher levels of psychological distress over the last decade than past generations, which has caused more cases of depression and other mental illnesses leading to suicide.
In terms of risk factors and causes, we have mental health disorders. Most commonly, depression and PTSD are listed by NIH as the most popular conditions. Next, we have drug misuse and overdose. Alcohol actually makes males 17 times more likely to commit suicide, and being in a frat surrounded environment adds on to that pressure of taking substances. Next, we have low socioeconomic status, pressures leading to not having enough money or feeling like a burden on the family. Next, we have environmental and school stressors, pressure to do well in school by family, friends, and the school itself, and lack of resources provided by the school to cope with suicidal thoughts and behavior. Next, we have a history of sexual and physical abuse as well as parental conflict, which may make males feel worthless. And lastly, we have access to firearms, which makes it easier to pursue suicidal actions.
So some current data is that in 2019, white males accounted for 69.38% of suicide deaths. And in 2019, adolescents and young adults aged between 15 to 24 had a suicide rate of 13.95 per 100,000. Next, boys are more likely to succeed in committing suicide. And lastly, in 2019, suicide rates were higher among white youth, which was 6.1 per 100,000 individuals, which was relative to Black youth, which was 4.3 per 100,000.
And next, we're going to talk about career pathways. So you can become a suicide prevention counselor, which focuses on suicide prevention, a psychologist, a general social worker, a clinical social worker, which focuses on the assessment and diagnosis of people, substance abuse and behavioral disorder counselor, which emphasizes on drug usage and alcohol-related content, a social and community service manager, and lastly, a child and family social worker.
For anyone struggling with suicidal thoughts, please call the National Suicide Prevention Lifeline or text TALK to 741-741.
For programs to help, we have peer support programs which foster relationships between peers for support. We have screening programs, which is a questionnaire that identifies high-risk adolescents and young adults and provides further assessment and treatment. We have school gatekeeper training, which helps staff at schools see signs for students at risk for suicide. We have general suicide education, which teaches students what suicide is, its warning signs, and how to help. And lastly, we have crisis centers at college.
For policies, organizational policies that promote protective environments may be implemented in places of employment, detention facilities, and other secured environments. Such policies and cultural values encourage leadership from the top down and may promote pro-social behavior, positive social norms, access to services, and development of crisis response plans. This can positively impact morale and help prevent suicide and its related risk factors. Acute alcohol use has been found to be associated with more than 1/3 of suicides and approximately 40% of suicide attempts. Policies designed to reduce alcohol consumption may have the unintended benefit of reducing suicides, particularly among young males. Increases in the excise tax on beer are associated with the reduced number of male suicides.
All our references are listed at the bottom as well. Thank you.